A very warm good morning to everyone. Myself, Dr. Kumar Saurabh, Department of Community Medicine, Government Medical College, Bettiah. Today, I am going to start a very important topic for your university exam and other interviews, that is biomedical waste management. So, as you all know, the waste produced in the healthcare activities carries a higher potential for infection and injury than any other type of waste. The Ministry of Environment, Forest and Climate Change, Government of India has framed Biomedical Waste Management and Handling Rules 1998, which was first of all notified on 20th July 1998. The first amendment was made on 6th March 2000. Later on, the second amendment was made on 17th September 2003. Now again, the Ministry of Environment, Forest and Climate Change has notified the new Biomedical Waste Management Rules 2016 under the Environment Protection Act 1986 to replace the earlier rules 1998. This provides uniform guidelines and code of practice for the whole nation. Now coming to the definition. So what is waste? Anything which is not intended for further use for the one who generates it is termed as waste. So what is biomedical waste? Biomedical waste means any waste which is generated during the diagnosis, treatment or immunization of human beings or animals or in research activities pertaining thereto or in the production or testing of biological waste or in health camps. So out of the total healthcare waste, around 80 to 85% of the waste are non-infectious, that is general waste, and around 15 to 20% are infectious and hazardous waste, which needs a special care. Now these rules shall apply to all the persons who generate, collect, receive, store, transport, treat or handle biomedical waste in any form. It will include all the hospitals, nursing homes, clinics, dispensaries, veterinary institutions, animal houses, pathological laboratories, blood banks, Ayush hospitals. Remember, this Ayush hospital was not included earlier, now it has been included. Clinical establishments, research or educational institutions, health camps, medical or surgical camps, vaccination camps, blood donation camps, first aid room of schools, forensic laboratories, and research labs. Now, who all are exposed to the risk of getting infected? So, the answer is the one who generates the waste. That is, we the doctors, paramedical staffs, etc. And the one who handles it, like sanitary staffs and workers in support service such as laundries, waste handling and transportation, etc. Even the patients and their attendants are at risk of contracting infections due to biomedical waste. So, why do we need biomedical waste management in hospitals? Now, in this picture, you can see that if the waste from the hospital is not disposed of in a proper manner, then it may have very severe consequences and may affect both human beings, animals, and even the environment. It may lead to infections like HIV, hepatitis B, hepatitis C, tuberculosis, and other water and airborne diseases. So, what is the possible route of transmission of infection? That is via intact or non-intact skin and mucous membrane, droplet infections by inhalation of pathogens, by ingestion of contaminated food and water. Now the salient features of Biomedical Waste Management Rules 2016. The Biomedical Waste Management Rules 2016 contains 4 schedules, 5 forms and 18 rules which tell us about applications, definitions, duties of operators and authorities, segregation, packaging, transportation and storage of waste, standards for the treatment and disposal, list and duties of prescribed authorities, monitoring of implementation of the rules in healthcare facilities, maintenance of records, appeal, and annual and accidental reporting. The State Pollution Control Board is the prescribed authority to ensure proper implementation of the biomedical waste management and handling rules in the state. All the hospitals, nursing homes, maternity centers, clinics, vaccination centers, laboratories, blood banks, etc. come under the purview of this act. Biomedical waste should not be mixed with other waste. It may increase the cost burden. Untreated biomedical waste can't be stored beyond a period of 48 hours. Biomedical waste must be segregated into different color-coded bags at the point of generation. All the bags shall be leveled and tied up tidily before transportation. So coming on to the difference between the earlier rules, which was made in 1998, and the new rules which come into enforcement in 2016. Previously, occupiers having more than 1,000 beds required to obtain authorization. In 2016, every occupier generating biomedical waste, including Ayush or health camps, requires authorization. Previously, operator duties was not listed. Now in 2016, the operator duties has been listed. In 1998, biomedical waste had 10 categories. Now in 2016, biomedical waste has only 4 categories. Previously, the rules was restricted to healthcare facilities having more than 1,000 beds. Now 2016 onwards, all the treatment and disposal facilities are mandatory to follow the biomedical waste management and handling rules. Previously, there was no any format for annual reporting. Now there is a format for annual reporting. Previously, there was 5 schedules. Now there are only 4 schedules. Now moving on to the penalty. The penalty imposed on whosoever persons or owners, occupiers found to be the cause of pollution, punishment is for a term which may extend to 5 years or with fine which extend to 1 lakh rupees or both under IPC section 15, 16, 17. If not complied, with a fine of rupees 5,000 per day extra, and if not comply for more than 1 year, then imprisonment may extend up to 7 years. As per section 17, the head of the department in charge of small unit may be liable for the punishment if the owner or the occupier produce enough evidence of innocence. So these all waste, they are to be collected in yellow container. The type of bag which is used is yellow colored plastic bag. The treatment and disposal is done by incineration or deep burial. The expired medicine can be incinerated or sent back to the manufacturer. Now moving on to the red bag. The red container will contain bottles, IV tubes, catheters, urinary bags, gloves, syringes without needles. So these all the waste, they are recyclable waste and they are to be segregated in red container. So the type of the bag will be red colored plastic bags, and the treatment and disposal will be done by autoclaving, microwaving. Now coming to white bag. This white bag is puncture proof, as the waste collected in this bag includes needles, blades, scalpels, all the sharp materials. The treatment and disposal is done by autoclaving or dry heat sterilization. Now blue container. Blue container, we have to segregate glasswares like broken medicine, vials, ampules, metallic body implants generated during the surgical procedures. So the type of the bag will be blue colored plastic bags. Treatment and disposal will be done by autoclaving, microwaving. So these are the containers. You can see 4 different types of container. They are placed in each and every hospitals, in each wards, emergency, ICU, everywhere. It has to be kept everywhere. Now these are the 4 different color bags. Now talking about the general waste, as earlier I have told you, 85% of the hospital waste consists of general waste. These general waste has to be segregated in a black container. Now coming to steps involved in biomedical waste management. That is characterization, quantification, segregation, storage, transportation, treatment and disposal of the waste. Now coming to the schedule 2, which consists of the standards for treatment and disposal. So it will contain the standards for incineration, operating and emission standards for disposal by plasma pyrolysis or gasification, standards for autoclaving of biomedical waste, standards of microwaving, standards for deep burial, standards for efficacy of chemical disinfection, standards for dry heat sterilization, standard for liquid waste. Now schedule 3, it contains list of prescribed authorities, that is the Ministry of Environment, Forest and Climate Change, Government of India, Central or State Ministry of Health and Family Welfare, Central Ministry for Animal Husbandry and Veterinary or State Department of Animal Husbandry and Veterinary, Ministry of Defense, State Pollution Control Board, State Government of Health, State Pollution Control Boards, municipalities or corporations. Now schedule 4, it has got 2 parts. The first part, that is part A, that will contain label for biomedical waste containers or bags. So you can see there are 2 symbols. The first one is biohazard symbol. The second one is cytotoxic hazard symbol. So the label shall be non-washable and prominently visible. Now part B, it has a label for transportation of biomedical waste containers or bags. All the details has to be filled. You can see here there is receiver's name, sender's name, address, phone number, etc. Now coming to form 1, already I have told you there are 5 forms. So let's start with form 1. It deals with accidental reporting. In any accidents, authorized persons shall intimate immediately to the prescribed authority and forward a report within 24 hours in written regarding the remedial steps taken in form 1. Form 2 and form 3 deals with application and authorization documents. The form 4 deals with annual reporting. So every institution has to submit an annual report to the prescribed authority in form 4 by 30th June of every year, which shall include information about the categories and quantities of biomedical waste handled. The form 5 deals with application for filing appeal against order passed by the prescribed authority. So this is the take home message, that is, let the waste of the sick not contaminate the lives of the healthy. Thank you.